Good day, everyone. Thank you so much for your time. I am Joshua Kate R. Maruzo, and today we're going to talk about and dig deeper about an important topic, which is the Graves' disease. But first, what is Graves' disease? Graves' disease is the most common condition of hyperthyroidism and is caused by the body's overproduction of antibodies to thyroid-stimulating hormone. These antibodies stimulate the thyroid gland to produce an excessive amount of hormones, and it binds to the receptor, causing it to activate continuously without stopping, which causes the production of large amount of thyroid hormones. Graves' disease causes many symptoms, including number 1, exophthalmos. This symptoms is one of the characteristic symptoms of Graves' disease, which appears in more than 30%, and this problem occurs due to the effect of immune inflammation in the body on the tissues and muscles of the eye. Number 2 is the skin problems, or the so-called Graves' dermatopathy are common symptoms, which is the redness and thickening of the skin on the legs and feet. Number 3, other symptoms, which includes the following. First, severe anxiety, mild tremors in the body, heavy sweating, goiter, rapid heartbeat, sleep disturbances, and many other symptoms that are shown in the picture. Causes and risk factors for Graves' disease. Number 1. There is no clear reason for the occurrence of Graves' disease, but it is generally caused by a disorder in the immune system that causes the production of antibodies that act as the thyroid regulating hormone, which causes the secretion of thyroid hormones to exceed the normal limit. Number 2, risk factors there are several risk factors that may increase your risk of developing Graves' disease, including family history. The risk of developing the disease increases if a family member is infected. Number 2 is gender. Women are more likely to develop Graves' disease than men. And of course, age. The risk of developing the disease increased in people under the age of 40. And last is the smoking. Smoking is one of the most important risk factors, and it is associated with more eye disease symptoms than non-smokers. Treatment of Graves' disease aims to stop the production of thyroid hormones and stop the symptoms that they cause in different parts of the body. Treatment can include the following. Number 1, radioactive iodine therapy. Radioactive iodine is given orally as it works to reduce the size of the thyroid gland and thus reduce the secretion of thyroid hormones. Second, anti-thyroid drugs. These medications block the secretion of thyroid hormones and usually include propylthiouracil and methimazole. Beta receptor blockers. The function of this drug is to prevent the effect of thyroid hormones in the body, which helps to solve the problems of your regular heartbeat, sweating, and muscle weakness. And of course, we have surgery. Surgery is usually resorted in the latter cases where part or all of the thyroid gland is removed, and in most cases, there is a need to supply the body with thyroid hormones after surgery. So we have here an additional information about Graves' disease. So aside from the treatment that I've shown before, we have here the 4 common thyroid tests. So thyroid disorder can cause a range of symptoms but can be diagnosed or ruled out with easy tests. Your doctor will determine which is right for you. First is the hormone level test. This blood test measures the thyroid hormone levels. The result can indicate over or underactive thyroid. Second is the thyroid antibody. This blood test measures thyroid antibody levels to see if an autoimmune disorder is impacting thyroid functions. Third is the ultrasound. This scan uses sound waves to make pictures of your thyroid. This is used to look for lumps that may be cancerous. And last but definitely not the least is the thyroid scan. This test uses dye and a special camera to look at the size, shape, and function of the thyroid, and it can identify overactive thyroid. And that's it about Graves' disease, guys. I hope you've learned a lot, and maybe it's time for you to think about your thyroid health condition and get some tests done.